The president has just signed a new executive order that seeks to put price controls on prescription drugs, which he says will lower costs by 90%.
The president says he's doing it for the American people. 2 News reporter Evan Bales spoke with an expert today. Evan, what did he say this new executive order will accomplish?
Brooke, Jack, the president has put drug companies and his health and services secretary on the clock to reach a deal on lower prices or else.
We're no longer paying 10 times more than another country. Whoever is paying the lowest price, we will look at that price and we will say that's the price we're going to pay.
This was the promise President Trump made to the American people today amidst the rising prices of prescription drugs.
The costs of most branded medications on critical disease states are very exorbitant, and that's why something needs to be done.
Americans account for nearly 3/4 of global pharmaceutical profits, something that the administration wants to change, putting the U.S. on a similar level with other global North countries.
They won't allow them to sell unless they sell at lower prices in other countries, which, given the R&D is kind of like a fixed cost, they can still afford to sell at a lower price to the other countries. But that means Americans are eating all of that R&D cost.
Drug lobbyists say that this is a bad deal and that the U.S. capping their drug costs would impact research and development efforts. Trump has also called on other countries to increase their caps, saying that that would lessen the burden on American consumers.
Not clear how his executive order gets to that yet. I wish him success. That would be a really big win.
A pharmacist I talked to says he sees firsthand the results of high drug costs, like people trying to stretch their meds, which reduce their effectiveness.
The ultimate goal is to protect the health of American people, particularly the elderly people.
Nearly 70 million seniors in America are covered by Medicaid, but it soon may cost more as a House bill introduced today would cut roughly $800 million to Medicaid. Live in the newsroom, Evan Bales, 2 News.